When we look at McKinsey's annual report on women in healthcare, the latest numbers from 2020 show that only 4% of women of color are actually in leadership positions. As we think about that, and we also think about what has really been amplified this last year in terms of health inequities, of course, this has always existed, but we've had more and more attention paid to this when we look at the pandemic and the lack of access and outcomes for Black and Brown populations. And for women's health, we see the worst outcomes for women of color, particularly Black women. So this is really important. We need women of color who are in leadership positions, who are designing, implementing, scaling. They're getting funded. They're the ones investing. We need them at the table. So I started Women of Community really as an advocacy effort to celebrate and elevate the voices of women of color who are working for the health of their communities. And the way we do our advocacy work is a few different ways. We engage in social media advocacy campaigns. So please do follow us at Women of Community on Instagram and LinkedIn if you haven't already. We have a monthly video series. We do quarterly events. This is our first one. And so we'd love to hear your feedback after this event because we plan on doing a lot more. And we also are going to be publishing our first newsletter. So if you haven't signed up for our mailing list, please do. That is our website listed right there. And we have a few things in the pipeline as far as collaborations. We're not making any announcements today, but we will be soon. And if you are on the line and you would like to collaborate, please do reach out. We'd love to hear from you. So we want to know from you, audience members, what do you think is the most targeted area of women's health that needs disruption, that is the thing that is up and coming in the next few years? Pop that into the chat. We're going to make a word cloud and we'll talk about that later during the panel.
Hi, my name is Maria Velaceres. I am a serial entrepreneur and venture capitalist. I'm the founding partner of Steel Sky Ventures, and we are a women's health tech fund. We invest in companies that improve access, care, and outcomes in women's healthcare. I am so excited to be here today and to feature great entrepreneurs, women's health entrepreneurs like Crystal. And that's the types of companies that we're investing in. We're investing in companies that are overlooked by other venture capitalists. Women's health is very underserved market. It's in Black and women of color are even more underserved. And so we take a lens when we're investing to make sure that we're addressing these communities that have been overlooked in the market. I also am on the advisory board of the Yale School of Medicine Digital Health. I'm on the board of Mass Challenge, and I'm also on the board of the National Patient Advocate Foundation.
Hi, everybody. That's Garner. Very excited to be joining everyone today. So I'm a women's health physician, an OBGYN by training, and specifically a GYN oncologist by training. I went to medical school at Harvard and trained there also, did all of my clinical training there, and then worked there for a few years before jumping over onto the industry side. So I've been working in the pharmaceutical industry, a little bit in diagnostics, but mostly in pharma, since about 2007. And in terms of, sort of communities I support and sort of what I do, in fact, a lot of what I do is sort of not directly related to my actual day job, right? So, I'm a chief medical officer for Obsiva, which is a women's health company. We develop medications for a number of different very serious conditions that are really still needing better treatments. So, my mission overall, I would say, in terms of my career has been really to focus on addressing unmet needs. But on the side, I do a number of other things as well. So I certainly mentor young women who are, and men if they wish, but it tends to be more women who reach out, young women in medicine or thinking about medicine, and especially folks in medical school or thinking about, next steps, that sort of thing. And then I volunteer on a number of nonprofit boards. So I'm on the board of the American Medical Women's Association, which is a really great organization whose mission is to advance women in medicine, but also to advocate for equity and to ensure excellence in healthcare. So that's a great organization. I also volunteer on the board of Corestone, which is a nonprofit that is focused mainly in developing countries, addresses resilience in girls and helps to increase resilience in young girls. And then lastly, I own a small consulting firm through which I provide expert consulting for companies that are working on women's health related products. So a number of ways that I support the medical community.
Hi, everybody. My name is Crystal Ibalocha. I am co-founder and CEO of Kira Health. We are a digital health company. I would like to describe us as revolutionizing women's healthcare by starting with the youngest population that needs the most care. And, that kind of segues into the question of who do you serve? So we serve young women in colleges and universities. And our whole goal is to create a safe space for them to, one, seek professional medical advice, but do it in a way that makes them feel safe and comfortable to share what's going on with them. So kind of like my personal background. So I'm an immigrant. I'm originally from Nigeria, like my sister here, Beth. And, so I moved here for college. And in that time, coming from a very conservative background, didn't quite have a lot of introduction into women's healthcare or even being able to speak about what was going on. So I relied heavily on the internet for answers to my health questions. And as you might know, Dr. Google is not the best place to seek professional healthcare. And I did, and that led to a very serious health condition where I actually passed out and was rushed to the hospital by my roommate for emergency surgery on a very different condition from what I was Googling. And, that led me to this path where I decided, well, how do you utilize technology to increase access and also, like I said, create safe spaces for young people? So right now, what we are doing is we're working with different colleges. We launched at a college recently. We're launching at a bigger college in California soon, which is a great announcement we're excited to do. And we're cutting across the rest of the US. We just got, we're available in 15 states in the US as of today. And being a 2-year-old company, that's sort of a big deal for us as we're expanding pretty quickly and making a huge impact. I would like to say my goal in life is to, be remembered as someone who did something like this to improve the lives of young people specifically, because that is, when you think about underserved populations, that is the biggest population that has been overlooked by healthcare in general and, innovation and everything else. And that's where we are playing as a company, and that's where we want to make the most impact. So that's a little bit about me and what I do on that end. I also run another organization called Femtech. So Femtech is a yearly conference bringing together all the different women in, healthcare, specifically driving change and innovation, folks that have been overlooked, underserved majorly. And, whenever people ask me, hey, do you know women of color in healthcare? I'm like, I know 20, 30, 50 of them. And that's because of a conference like that kind of brings them together. We're hoping to do one this year, so I will announce it soon. But yeah, that's a little bit of what I do outside of Kira.
And who's invested in Kira, Crystal?
Invested? That's a good question. We have a lot of amazing investors. Some of our investors now are Serena Ventures. So the Serena Williams' fund is backing us. So that's kind of like our claim to fame. That's the one thing. And we're also backed by a Bumble fund, the Bumble that just IPO'd, and a few other investors, including New York Venture Partners, Accelerprise, 500 startups, and a few other incredible investors. So to name a few, but yeah.
So this is why I said I can't introduce all of you, because you guys have such amazing backgrounds. You guys, you literally are such successes within your own, your fields. And I think that we have so much to learn from you all. And so my next question for you guys is really about your journeys. So I know you didn't start here, and it's been a journey getting here, and representation matters. You don't see very many women of color being pharma executives, being investors, securing funding from all these amazing venture funds and starting their companies and scaling to 15 states in 2 years, all these different things. It's incredible. So tell us a little bit more about your journeys. And I'd love to specifically hear what rules did you have to break or risks did you take to get to where you've gotten to?
I'm an immigrant, so being in the U.S., being that culture shock in itself, and navigating school and everything, and all the expectations that my parents had for me to go to, law school, which didn't happen. But, I fell in love with this space. I fell in love with solving the problem. I think that was the main thing. But, the way that I've done it has changed over time. But that has been very important. And when I first started, being someone who's not a healthcare expert or like a subject matter expert, so to speak, but I've always been an entrepreneur. When I was in college, I started my first company, an e-commerce company, and we were making hundreds of thousands of dollars while I was in school. And that in itself was, a move where I was like, I can do this full time when I graduate. But then I left that to do something that I felt would make a huge social impact. And that was the main driver for me. And the risk, I would say the main risk that I took was shifting from what was expected of me when I graduated. So my parents were asking, when will you get a job? When will you do this? I'm like, I'm running this company. I'm trying to. And they didn't quite understand it for the longest time until they saw, a Forbes article that had me on it. And they were like, oh, you're doing something important. I'm like, yes, I am. So, breaking those types of rules of what's expected was the first thing. And I remember, I had a really comfortable job back in Austin, Texas when I graduated. And one day I just quit my job and got in my car and drove to California. So I did a 22-hour drive by myself to California to start this new adventure. And I do not recommend it. Please go with someone if you ever try to do that. But, that was an uncomfortable space to be in, like just saying, I'm going to put all my eggs in this and I'm going to try to make something work. Of course, I was prepared. I had like a year's worth of savings to back me, and stuff like that. But still, having to leave a job where I was fulfilled to the extent that I was, but really knew that it would take much longer for me to make half the impact that I've made so far. It was really important to make that pivot early. And really be convicted in the fact that regardless of what happens, I mean, a pandemic happened and we had to pivot, right? But regardless of what it is, we're still going towards a certain mission. And that's, kind of where I'm at right now, and super excited to continue to do this work. So
I love that you highlight that. I talk about that a lot with other women of color who have immigrant parents, in that the dream was to get a job at a stable company. The dream was to have a stable career. Being an entrepreneur is not a stable career in their eyes. And so you do fight, you have to fight that narrative and really advocate for yourself and get your parents to and your rest of your family to kind of come with you. So I love that example, Crystal. Maria, what about you?
So my journey starts as an entrepreneur as well. I started my first company at 19 at Wake Forest University. It was the first online shipping and storage company for college students. Joined forces with a friend from Duke. We created a company called College Boxes. We grew to 50 schools by the time we graduated. And now it's the largest college shipping and storage company in the nation. And it was subsequently bought by U-Haul. So that was my first foray into the business and entrepreneurial world, but I knew I had a lot to learn. So I spent the next 15 years of my career filling in the gaps. I really architected a plan to pick up all the tools I needed before I built my next empire. So I was a computer science and business major. So I was a tech strategy consultant at Booz Allen, checked the box there, went to get a finance degree at NYU. Then I wanted to learn how to build products. So I went to Kraft Foods and I learned how to take a product from idea to putting it on the shelves. And a fun fact, I invented the extra large Easy Mac cup. So if you and your children are eating that, you can thank me. Then I worked at a branding agency because I knew strong brands were important. Then I needed a global role because I really wanted to understand how to work cross-culturally. So I took a job at Samsung in South Korea and then intermittently was going to Amsterdam for work as well. Then landed back in the US and helped scale a large dermatology clinic. And we received VC backing, and I met this doctor when he had 2 offices, and we ended up scaling, and now they're the largest dermatology clinic in the Northeast. So have a lot of experience in operating and growing companies. Then I wanted to learn how to invest, and I joined a group called Pipeline Angels. I learned how to invest. I invested in 7 companies, 5 of them were in women's health, and I saw a huge opportunity here. So last year, I decided to kick off fundraising for my Women's Health Fund, and we're really excited to be there today and raise a $50 million fund investing in women's healthcare, and we invest in the companies that create access, care, and outcomes in women's health.
Yeah, I just love this. You ladies are unbelievable. So, so I was born in Nigeria, yay. My mom is an American citizen. She was in the Peace Corps and went to Nigeria with the Peace Corps way back in 1962, one of the first waves of the Peace Corps, and met my dad there, and the rest is history. So I was born and raised there, and I was actually born right at the beginning of the Biafran War, for those of you who know about that. But, you know, I knew for probably my whole sort of early years that I was likely to go into medicine. I thought I'd be a pediatrician though, and you know, take care of little kids because I absolutely adore children more than anything in the world. So I started out at Mass General was the first hospital where I started out in internal medicine actually, and got very bored very quickly and realized, no. And one of the first things I did that was really sort of not common is I switched residency programs. I switched from medicine and pediatrics over into OBGYN. And that was really hard to do, right? Because when you start in a certain training program, it's expected you're going to be there. And, you know, a very small number of people who are in the program, every single person's critical. And to sort of show up and say, I'm leaving was really, really, really hard. But so glad I did it. Switched over into OBGYN and then subspecialized in GYN oncology. And I think I saw the name of one of my teachers during my GYN fellowship on the line today, Dr. Sheets, who was very influential because she went into industry several years before I did. So that was a big move. And I realized, industry, that's interesting, you know, and at the same time, I was also just clinically just really, really, really busy, but trying to do research on the side, which is virtually impossible to do. You can't really achieve anything. And I was already sort of starting to think, well, I'm not going to cure ovarian cancer. I'm not going to find the way to diagnose it early. And lo and behold, I got an email from Merck asking if, you know, it wasn't just to me, it was obviously to a lot of people. I responded. And yes, said I was interested potentially in going into industry. So that was another thing I think very difficult to do, especially at an institution like Harvard that is evolving, but at the time was really sort of, you know, not favorable towards industry. And so, you know, for all the time that I was planning to leave, I kept hearing, you know, you're going to the dark side. Oh my God, you're, you know. Whereas for me, the reason for moving on was I realized I could have more impact than one patient at a time, right? If you're in the industry. So the first thing I worked on was the HPV vaccine. Of course, that's having a huge impact out there in the population in terms of reducing HPV disease, cervical dysplasia, cancer, and so on. And then I think the next thing I did that was not very common is I left Merck, right? Most people who go to Merck sort of stay there forever because it's a great place to work and a great place to learn. But I realized that I wasn't going to be able to sort of go up the hierarchy quickly enough in a huge company like that, right? So I needed to switch around. And that's how, in a much shorter time, I would say, than most, I was able to become a chief medical officer. I don't know what the next steps are, but I think like both of my colleagues on this call, I'm always interested in, you know, sort of what next. So, you know, definitely thinking about other ways that I can lead. But yeah, it's been an interesting path.
Yes, it has. There's definitely a theme here in that you did something different than what was expected of you or told of you, right? So that's awesome. Now I'm going to ask Elaine, is our word cloud ready yet for areas of opportunity? Thank you. So the question that we asked, right, was what is the biggest area of opportunity? We understand there's a lot of hype, up to 600 billion coming into women's health. Where is it going these next few years? Women's health is huge. So we see telehealth, health literacy, first of all, huge right there, right? But the other ones that pop out, fertility, digital health, telehealth. Do you believe the hype? Do you really believe it's going to be about, up to 600 billion coming into the industry? When we think about women's health, again, a lot of things are included in women's health. What do you think are the most important things coming up? When you think of your own ecosystem and world, what does that landscape look like, that evolution, as you see your work evolving the next few years?
I definitely see a lot of acceleration in telehealth and digital health. Our whole fund is really focused on this and really creating and architecting what healthcare 2.0 looks like. So we were thinking that we were investing in telemedicine. We invested in telemedicine 3 years ago, and we're like, maybe these small companies will accelerate in 4 to 5 years. Then COVID happens and we're off to the races, and these companies are accelerating and growing. And I don't think we're going to be turning back. And so I really think we're going to start to see more digital health companies pop up. And in women's healthcare specifically, some of the verticals I'm especially excited about are menopause. So 1 billion women are going to be undergoing menopause in 2025. We need more stuff on the shelves for them. And that's what we're looking for. And so we're working with our corporate strategic partners like J&J, P&G, and Target to get things on the shelf, get more solutions to make life easier for women. So we're really bullish on menopause space and the digital health space, and also new care delivery models as well.
Yeah, well, I can jump right onto that because, in thinking about this panel, and sort of the really key areas, absolutely. Menopause, I think, is huge. And of course, as a menopausal woman myself, I can say that clearly we need more solutions. And I think in many different areas, right? I mean, we need better medications. I think, first of all, even before that, we need a better understanding, right, of scientifically, I'm talking about what the heck is happening, right, to a woman's body as she goes through menopause, and sort of what are the mechanisms, right? Why do women get hot flushes? I mean, we know it's related to estrogen, but really, what is the actual, what's actually going on, right? So that we can sort of, in a targeted way, treat these various conditions. So menopause, I think, is huge, and not only in terms of drug development, but also just, I think, what you're saying, Maria, around getting menopausal women sort of included in sort of the Femtech movement and innovation and ways that to make their lives easier, right? I agree. Sorry, my sound, it sounds like it's still pretty bad. Health literacy, also another huge, I mean, this is for me a huge part of my sort of mission, really, is to help women of all ages now understand their bodies, right? Just the very basics. I have a daughter who's 21 going on 22, and I'm surprised sometimes at just, the stuff that she and her friends just don't know. I mean, and the challenge is they rely on each other, I think, too much. I think Crystal would agree, right, for information, and then they get misinformation. So I think really, developing easy and safe, like you said, Crystal, ways for women of all ages to get really important information is a big piece of what I think about.
I think it is health literacy, education being a big piece of this entire conversation. Now, when we think about it, yes, I know there's like lucrative pieces of women's health that like investors are more interested in, and where healthcare in the US, as I know and have realized being an immigrant and coming here and seeing the differences, is very reactive, right? A lot of people seek healthcare when they're really sick, or when they're now pregnant, or when they have like a chronic disease. Like that's where health plans are more invested, because they're like, oh, reimbursement and things like, so things have to go with money a lot, right? And it is important to deal with these chronic things, but educating folks very early will impact the way people live their lives when they get to different stages of their lives. Now, when we think about like women's health and the scope of it, I always think about it in different life cycles, and how those life cycles kind of, talk to each other in a way, and there's a ripple effect, right? When you start educating a person really young about a certain thing, they wouldn't have to deal with something like I did when I was 17 years old in college. So I started college really early, being a Nigerian kid. So, I was 17, and kind of like I started at 16 actually. So imagine that that age where you're in a new place, you don't have any education about your health, and then you're relying, like Beth said, on your friends. And that's for a young person. And you might think, okay, that's a young person. But then when you go down the line to folks who are like 20 and then they're like late 30s, even, they haven't been educated about their health at all. Right. One of the bigger things my co-founder, who's an OBGYN, always says is whenever she sees patients and they come in and they're like in their late 30s and now pregnant, the kinds of questions they ask, she's like, you should have been taught this in middle school, and that's a problem, because then they start having all these issues and underlying issues that would have been addressed really early. So I think it's about starting earlier to educate people, but then making sure there's there's things that are set in place for the different stages. So when we think about like the maternal mortality in the US, like a lot of these things can be mitigated. Yes, there's the cultural competency side of things. Yes, there's the racial bias and things like that, but then there's also the general lack of care and access. So access being a bigger thing. So when you think about telemedicine, you're improving access by venturing into things like that, but you have to back it up with education across the board, even education in menopause. So some people, yes, they don't know what they're doing, they don't know what's happening to them. My mother is menopausal, and she's like, if you even hear the kinds of conversations she's having with her own friends, I'm like, I know more than you guys. So across the board is important for that education and health literacy piece, at least from where I'm standing.
One other piece to go ahead, Maria.
There's Sheila in the chat. She's been really on point, and I wanted to address what she said with culturally based care, culturally competent care, and Crystal alluded to this too. That is something that we're seeing. We need to get people of color to be able to trust the healthcare system again. And the only way we're going to do that is to match them with people that they can trust, which are people that, if you're Latina, that they speak Spanish and that you trust them. If you're in the Black community and you're giving birth, you need to talk to a Black doctor, because we know there's a history of people not listening to us, not taking our concerns seriously. And so that's the only way we're going to re-engage this community in healthcare in a meaningful way, is to have culturally competent companies that are really keeping this top of mind. And I think the payers are starting to see this too, and they're really starting to take notice to it and to fund companies like this. So I think that if when you guys see these kinds of companies in the market, please support them, because they need to show traction. They need to show early traction, because people aren't sure if these companies can be big, but we know they can be big, because women of color are a huge population. We're having babies at higher rates. So these are the types of companies that we're asking you to support, so that we can continue to create good culturally competent care.
That's great. Yeah, Beth.
And one other point is, I think that I saw also, I think this is also the same person, I'm trying to go back up in the chat that you mentioned, Maria, who's clearly making a lot of really excellent points, but the stigma issue, right? So I think that until women can be completely comfortable talking openly, not just to each other, but I'm talking in the workplace, wherever, with men, about the things that are happening to them on a daily basis. Infertility, miscarriage, bleeding, heavy bleeding, hot flushes. Women just are unable, right? We just don't feel like we can talk openly about this stuff when it's happening to all of us, right? So we also don't understand, I think, we suffer in silence, women have a miscarriage, and, it's huge news if, a celebrity dares to say she had a miscarriage. Miscarriages are so common, and it should be easy to share this and not feel like you have to, hide it and not talk about it. And we can talk about so many other, similar situations, right? So, and I think for me, we look at other movements that have happened, right? Me Too is a great example. Now, I know people have their different views about Me Too, but it's just an example of, one person decided, okay, I'm going to put this out there. And then you saw, the acceleration, and we got to a point where now I think it's something women at least feel they can talk about without necessarily getting severely punished for it, right? So same thing. I think it's going to take sort of grassroots, honestly, communication and things like this, events like this, right? Where women are just speaking to each other. And the work that Crystal is doing and Maria by investing in all of these companies little by little, we grow our numbers, we grow, and get the word out, and then we destigmatize. Then we're able to start actually solving the problems, I think.
Yeah, absolutely. And I just want to call, I hosted a different panel this morning, and it was talking about storytelling for the health of our communities. The amount of tools that are available now too. Like there are healthcare influencers on TikTok, making like dancing videos. There are OB-GYNs, and they're like people who are educating through these platforms. It's amazing. And so I think, right, when we think of the future and what's possible, health literacy and the tools that we have now, and the global reach that's possible is pretty awesome. So my next question to you all, when we see a panel of all males on stage, there is outrage. Like there are so many, like people are taking people down on Twitter, right? Like, and when we see a panel of all white people and that panel happens to feature a white woman, you don't always see that same outrage of why don't we have people of color? Why don't we have women of color on these panels? And as somebody who arranges a lot of different events, I sometimes hear from people, well, I don't think there are a lot of women of color who work in this space. And that's just not true. That is just not true. It's you have to be intentional about growing your network to have these people. So something I always ask in every forum, as a woman of color, you usually know lots of other women of color who are working in really critical spaces. So my question to you all is, who are the women of color working in women's health innovation that everyone should start following immediately? And if anybody is planning an event, they should be having those people at their event. Crystal, I know this was like right away, you sent me like 20 names. So why don't you kick us off?
So yes, that's my favorite thing to talk about. I was actually supposed to be on another panel. I'm jumping off of this one when we were done to go on that one with women of color who are doing amazing things in healthcare. So some of the ones that were put in the chat already by Diana are some of my good friends. So Kimberly Seals, founder of Earth. If you haven't checked them out, please do. They just launched a product, and it is around vetting, so to speak, or leaving reviews about your experience with a gynecologist or a hospital or a doctor. So it's where Black women will go to after they had an experience and just leave a review about that hospital. I think what they're doing is they're sharing that feedback with the hospital and saying, hey, XYZ Black women are complaining about this, do something about it. As you know, they want to be seen in a positive light, so they're responding to those things. So getting feedback is important. So that's the amazing work she does, along with everything else that she does. And then, of course, Melissa Hanna, founder of Mommy, really good friend of mine. They're working in the pregnancy, postpartum space from birth to first birthday, I believe. Have that stuck in my head. So that is an amazing founder that I know is doing great work. There's also Ashley Wisdom over at Health in Her Hue. You probably might have come across them on Instagram somewhere, but she's an amazing founder. We're kind of like friend buddies and bounce off ideas of each other. They are a platform where you can go and actually find culturally competent providers. So they have a directory of women of color that you could actually go and look to if you want to see a doctor in person. So they do that piece around matching folks to find the doctors to talk to, but they also do a lot of stuff around education. So that's that. I'll stop there because I know there's other people that you guys know.
Yeah, but you have a great point. We're going to be dropping links in the chat. So as Maria and Beth, as you guys name yours too, we're dropping links. So people, please do check them out. Maria.
Great. So I'll name just a couple. Crystal said, the superstars that we know in the space. There's some other ones that you may not know about that have gone on to raise really big companies. So for instance, City Block, Toyin Ajayi, they are now $1 billion company, a unicorn, and one of, the first Black women unicorns, her and Julia Collins. So we're really excited about her. And there's Crystal Etienne of Ruby Love, which is, it's kind of like a Thinx or a Spanx, and they have period underwear. And so that's another one to keep on your radar that you can buy right now. And we want to tell you not to support these women, not only to just keep them and email them on LinkedIn and ask them to pick their brains, but you really want to support their company so that they can grow and that we can start creating Black women billionaires, so then more people will start to invest in us because they will see our worth and the types of companies that we can create. And another one, Maya Hartigan, and she is a creator of a company called May, and they are doing basically a doula matching platform for Black mothers in culturally competent care. So those are the three I would say to watch out for.
The other person you already mentioned, who is Christina Eckridge. I encourage you to check out Christina's organization, Elevate Health. You know, they're putting on plays that were just amazing, that sort of addressed various specific issues around, you know, minorities and women.
Please do reach out to these women, have them at your events, have them on your panel. And as Maria mentioned, support their companies, support their products. For folks on the line who may want to go into investing, who may be trying to build a company in women's health and secure funding, or for folks who are clinical or trying to make the switch to industry, what are some pieces of advice that you all have for them?
I would say make sure that you understand if you're building a lifestyle company or a venture-backed company. Not every company needs venture funding. A lot of companies can grow and be very successful on their own. My first company, I did get, $1 million of venture capital funding. My second business, I didn't. I grew that grassroots by myself because there's a lot of pros and cons to taking outside money. There's a lot of voices at the table that you may not want to listen to when you're trying to build your own company. So really kind of understand if your company is something that needs venture backing or if this is something that you can grow on your own and make that successful. And then I would also say, to really think about the market size. If you do want to go after venture capital dollars, we need to be addressing large markets. And like Crystal said, we're very focused on returns, right? If you're going to an angel investor, they may be able to invest for emotion, for passion, for change they want to see in the world. And I was able to do that when I was an angel. But now that I'm on the venture capital side of the table, I'm investing other people's money who are expecting me to make returns. So I have to make sure that the companies I'm investing in can make really significant venture returns. So just really kind of think about that as you build your business, which business model is best for you.
That's awesome advice. I would say, and I think that Crystal's story really illustrates this beautifully, which is, be observant, right? Think about kind of your daily life. What issues, problems, do you face? What information do you want? How would you like to get it? What ways could you think about, your phone maybe being used to improve your life or solve your problems? I think there's so many examples of, people starting what have turned out to be enormous companies, not necessarily in health, but just based on really just kind of suddenly identifying a problem that could be solved. I think also just you've got to believe in your ideas. You've got to believe, right? So I think it comes down to kind of passion and true belief and confidence, right? One term that I hear so much that I just want to get rid of in a world out there is this whole idea of imposter syndrome. We are all capable people, and there's no reason that women should feel any less capable. So I think believing in yourself and then willing to take risks, right? Do things a little bit differently. I think we've all talked about that. Work super hard. I think it's sort of as simple as that in many ways. I think, there's a tendency to look at others and think, but they make this look so easy, and recognize there's a lot of failure in the background there. There's the failure before success. There's success and then failure. I think understanding that blood, sweat, tears behind the scenes, I think is really important, and to ask people about it too. And then lastly, network. It's all about getting to know people and really just putting yourself out there.
Yeah, I agree again. A lot of what you just said, Beth. I think putting yourself out there is very, very important. When I think about my journey as a person and as an entrepreneur, I remember being in a place where I felt like I wasn't good enough to be in front of investors, and I wasn't good enough to run a company of this magnitude, and feeling like I had to be more ready to do certain things. And, going into healthcare, I was like I said before, I'm not a physician. Like, what do I, but I experienced something that led me here. So what I did in the beginning was I started asking a lot of questions. So I went on LinkedIn and I followed over 1,000 people who were physicians at the time. If you go on my connections, there's a lot of doctors on there. I talked with so many people, one of them who ended up becoming like an angel investor, and I didn't know I didn't know what an angel was. I didn't know anything about, raising money or any of those things. So, the more questions I asked, the more I learned where the gaps were. And the more I even learned that even the physicians had problems that they needed to solve, but they were focused on delivering care that, innovating was not quite on their personal roadmap. Mm-hmm. So for me, it became a thing where, okay, I can innovate and I can hire these people to do the clinical work, right? And that became my job, right? As a CEO, my job is to bring on people who are smarter than me to get things done, right? From an educational background, even from like a personal background, just generally, I surround myself with a lot of people who are knowledgeable, who I always learn from every day. I think that's a big thing. And putting yourself out there is very important, because in the same process, I was not ready to raise money in the beginning. We were not ready as a company. We did not have any traction. So I started to gain traction somehow. And the way I gained traction was by doing a lot of pitch competitions. So I was on stage almost every day. And a lot of people know me for being on stage. That became kind of like my thing, right? I won a lot of free money being on stage, hundreds of thousands of dollars. And I used that to develop the company to the place that it was, to where I became confident to seek out venture capital, right? And it's very important to think that way, because kind of thinking about dilution and ownership and not wanting to just throw yourself in a space where you're not really familiar with. So even, when we talk about stigma, the original name of our company was actually Clit Health. So KLIIT, like the clitoris. So I would go on stages and I would say, who here has a vagina? And the men would like turn up their nose and they would be really shocked. And like that shock factor made them be like, who is she? And they always remembered me till today. So,
great.
Our goal was to destigmatize these conversations, and we did a pretty fantastic job at it in the beginning, when we were not really focused on like being a B2B company. We were more direct consumer. So it appealed very well to that audience. Now, when we made the pivot was when we decided to go into telemedicine and selling into schools and having a mascot. So Kira itself is a penguin, so it's a mascot. So that was where the shift happened. But initially, I was very confident in the fact that I would go out there and I would say what I want to say, and people would listen because they've never seen anyone like me. And I'm very happy to be the only one like me in a room all the time. So those are some of the things, and just echoing your points, Beth, but that's my experience generally.
That's fantastic.
I love that. And actually, it leads to this next question that folks had. So when we think of, because this is great, Crystal, in terms of the men in the room, when you would say that, and that they remember you. But when we think of allies, whether that is white allies, male allies, how do you engage them in this work? And how do you get them to come along with you? And what are some of the most impactful ways that folks can support women's health, women of color working in women's health, so on?
I think the best way to get male investors on board and male allies is to show them the returns. At the end of the day, they don't really care what you're building. All they care is how much money they can make off of it. So I think as women's health investors, while we're very passionate about what we're doing, sometimes you need to flip the script when you're talking and trying to raise money from different types of audiences. Men especially, they may not understand endometriosis or female sexual health, but what they understand is a curve that goes up and to the right.
I absolutely love that. I think also that, it's, to me, the interconnectedness, right? So, a white male, for instance, who's 55 years old may think, well, what do I have to do with, wanting, a young Black teenager to be vaccinated against coronavirus, right? What does that matter to me? Well, guess what? That young female may be working in the restaurant that you're going to, or you're at the McDonald's to get your fast food, or, you are going to come in contact, if not directly, somehow you are we're all in contact with each other, and that's true around the world too. I mean, you can think about, it's in the news a lot around how developing countries are not getting, vaccines and may not for years. Well, let's think about that. Does that affect us? Absolutely, right? Because people travel all around the world. So I think just really sort of trying to help people to sort of connect the dots and understand why we're all basically one big, huge community when at the end of the day.
Yeah, and I'm coming from this as a founder who has just raised money and has spent all my time, talking to male investors, right? I think there's two things. Yes, showing, your revenue and stuff like that is important. But I have also seen a lot of my male counterparts who don't have a product, who have never built anything and raised 5 times what I did. And I was mentoring some of them. And I'm saying this because, a lot of investors, especially like new ones, don't get the fact that like women drive a lot of these things now. Not having money to build things is a barrier, and it's a big one, because like I said to you guys, like I had to raise money some other way because no one respected what I was doing and no one was willing to listen to me, right, in the beginning. And it wasn't about how many users we had. It wasn't about how much money we were generating at that point. It was just a lack of understanding of what we were doing, period. And then when it started to shift was when they started to see us in the press and started to see us doing XYZ and started to see us being backed by women and see us being backed like a celebrity, for example. It became a moving train that people were trying to hop on top of, and we had to make that decision to say, no, we don't want you. No, you're not aligned. And we came to that place where we could say that. And not a lot of people get to a place where they can say that because they don't have the first shot at it. I remember the first man that made the investment in me. He was an African-American man that said, Crystal, I know this is $1 billion opportunity, and I know you are just getting started, and I've seen the tiny things you've done, and I think if we infuse cash into this, you would skyrocket. And what he started to do was he started to even educate other men about what we were doing. And it got to a point where we had one specific investor who was on the fence for a while. And then they sent a female associate to talk to me and use our app and told her to tell me to walk her through it. And I walked her through it and I was like, does it make sense to you because you're a woman? And she was like, it makes sense to anyone. And I was like, you know what? I don't know what to tell you. Go back and tell your people. Like, not in those words, but it was more like, go back and tell them. It was until she went back and explained it to them in a way that they could have understood that they became more interested, right? And the place we were when they were looking to do that investment and today, they're two very different places just because someone gave us a shot. And I think it's important to think from that place because like I said, I know so many men who do not have revenue, do not even have, and they use their $1 million of revenue to build their first product and do their MVP. I built an MVP with my own cash and eventually pitch competitions. But that's something that, we need to get to a place where folks are really invested in trying to make a difference. It's one thing to talk about wanting to make an impact, but actually doing the work and the uncomfortable things to make sure folks are, listening to women more. And folks actually make a mistake maybe once or twice, that's okay. But there haven't been enough mistakes made for women, but there have been a lot made for men.
But I wanted to just leave with one thing for audience members. Name one thing they can do to support you all and accelerate your work.
Just as hard as it is for Crystal to raise money, it's equally as hard, if not harder, for me to raise money as a Black capitalist.
That's great.
There's less than 0.6% of Black women fund managers, and I'm trying to pave the way so that we can give more money to people like Crystal. So when you have a chance to invest, please try to invest in a minority or female-led fund.
I would say advocate. I fully agree in whatever way you can for more investment in women's health.
I have a lot of people coming to my LinkedIn and asking to pick my brain, but I'm like, have you used our product yet? You need to go do that first and give me feedback. That would help me scale. So my ask is just, check out what we're doing. I put a link to our membership. We have live membership so folks can become members of the Kira platform. So that would be great if you guys can, join our community. So.